Hi everybody. I wanted to talk a little bit about what is actually going on with my body. Just so people know what's going on, but also to bring awareness to what this is. One aspect that's going on with my body that's the main part of what is making it rather unbearable. Also, I have these white gloves on. One, because I'm looking cool in them, but also because my hands and wrists are looking really beautiful or really rough, so I don't want you all to see that, even though maybe I should show you, but we're just gonna look like Mickey Mouse or Minnie Mouse. Alright, so I have what is commonly referred to as topical steroid withdrawal, or topical steroid addiction. It really maybe eventually will be called corticosteroid withdrawal, as it's any type of corticosteroid, not just topical. So it could be an albuterol inhaler, which is steroid inhaler, steroid eye drops, or oral steroids, steroid injections. And it's the overuse of it, which it's a little convoluted on what that is. Technically, you're not supposed to use topical steroids more than 2 weeks in a row, but there's no clear definition of how long in between. Like, you use it for 2 weeks, do you wait 6 months, do you wait a year before you can use it again? But also, that is not really, you're not really told that at dermatologists, as I would test that out when I would go to dermatologists, as I have been anti-topical steroids for many years now, but here we are. I don't know if I've noted this in the video yet, but topical steroid withdrawal can last, depending on how long you've used them, from a few weeks, a few months, to multiple years, many years, to indefinitely, just again depending on what you used and how long you used them. Once your body is addicted to the steroids, when you go off the steroids, you basically no longer really have a true skin barrier, which is why you can kind of become allergic to everything, at least in my case and in many people's cases. But it's also referred to as red skin syndrome. Steroids, corticosteroids, are vasodilators, so once you stop using them, and your skin is addicted, you just kind of turn red everywhere. But you're not just red. You are also extremely itchy, so you'll probably see me scratching throughout. My skin has it'll ooze, it'll rip open. It looks like I've been burned everywhere. It feels like I've been burned. Stinging, bone deep itching. You get something that's referred to as elephant skin, where your skin is really thickened. I mean, you think of an elephant and how all elephants, if you look at their skin, they look really old. That's why for the past few years, I've been looking a whole lot older than my age, which I'm 33 right now. I mean, it used to be even worse, much worse than it even is right now. Especially this eye right here, this buddy. He's always like scrunched up. All of that's going on with your skin. It is not just rashes. It is not just eczema. It is so much more. Your hair also can fall out. I have a lot of this hair that falls out. I usually lose my eyebrows. This one, he really likes to fall out. I don't know why. This side, it just wants to go. I don't know why I'm referring to this eye as a he, but we are. I also haven't been sleeping at all. Another humongous side effect of this. The itching that happens, again, it's not normal itching, and it is extraordinarily worse at night because your cortisol levels, which help control inflammation, lower they go lower at night. So all of your inflammation, your skin inflammation, is just like beyond magnified at night. So that's why I am awake just all night. That's why people with topical steroid withdrawal, I'll call it TSW, just do not sleep. I mean, I used to have nights all like consistently in 2020 and 2021 when this was at its worst. I would sleep sometimes 30 minutes a night. Literally, I would sleep maybe an hour, maybe have a few naps, a couple naps in the day, but quite literally not sleeping. I actually don't know how I did that. I don't understand how the body does that. Right now, I mean, I have had nights where I haven't slept at all, but maybe it's more like 2 hours, 3 hours, maybe 4 hours, maybe on a good night. But it's always broken up, like 30 minutes here, 20 minutes here, an hour there, never in a row. What I used to do, okay, my brain it's not functioning right now. What I used to do when I would scratch beyond belief at night, when it would get so bad, I would, when I was being slightly kinder to myself, there was this brush I would get and just scrape it all like on me. And of course that would scrape me up, rip me open, bleed. And there were a few times when it got so bad, I did get a fork and I was just scraping it on my arm, ripping my skin open, blood everywhere, because this itch it's like, I think I wrote about this, but it's like a electrified shock, burning pain of an itch that you just like want to get out. It's hard to explain unless you've experienced it. Also, it hurts to take baths or showers or for clothes to touch you. I can only wear certain clothes right now. And even then, I don't really like to wear clothes. But then, anyway, yeah, I'm not naked all the time. I wear clothes. But back to the shower, when it was at its worst, I would literally just cry throughout the shower. I would cry and then scream because it's like, again, like these like sudden shocks, and it almost causes me to have like a spasm because it's such a shocking itch, pain that happens. So cry and scream throughout the showers. It's not as bad now showering, but I still jolt and sometimes cry, but we try not to do that, which it's okay to do. Just to recap that a little, so it causes, you don't really have a skin barrier, and your skin is just kind of trying to recover from all of this. So your skin is oozing, it's swelling, it's red, it rips open. I have had some recently where if I just move my wrist, all these little slices just open up. I'm not even scratching, and just slices open up, rip open, and blood comes out. And it's not everywhere doing that, but it used to be that I would just move my arm, this would rip open, the back of my knees would be ripped open. I guess this isn't a recap, I'm just saying more. When I, again, was at my worst, or even occasionally with certain parts of my body, when I would wear clothes, my skin would be oozing so much. It would like ooze and then dry a little, and my clothes would be stuck to it. And if I'm walking around moving, I remember being at work, and it would just like rip open, and I would have like blood and other gross oozingness coming out of my skin. And when I would take my clothes off, it would rip layers of my skin off, of course, so more oozing blood. You have to wash your clothes a lot. during this time or during that time. Your skin's just flaking everywhere, which is really gross. Sorry. You're not sleeping at all, which kind of makes you go a little crazy. It also really affects like my ability to recall words and think clearly is really lacking right now, and especially oh, sorry, I just got confused about something on my phone. A couple other things that happen are thermoregulation issues. So I don't quite understand it, but you can't really control your thermoregulation very well. So I'll have extreme hots and extreme cold. It has to do with your body trying to heal itself and putting heat towards certain things at different times. So at night especially is when I'm very hot. It's like I have heat just emanating off my body and I cannot get comfortable. It doesn't matter if I have air blowing on me, I have covers on or off. It is, I have trouble explaining what it feels like, but it's just like my skin is a furnace and I cannot get comfortable. So I especially can't sleep with that. But I also get really, really cold and nothing keeps me warm. And that's usually during the day, especially in the mornings into the afternoon. I can't go outside because of all of the allergens, because your skin barrier's all messed up. It's like the allergens just get in you immediately, and maybe they even get to your bloodstream, so that's why. I don't think I explained that well. I'm not a doctor. Don't trust everything I'm saying or the way I'm explaining it. But I will usually have immediate reactions. Heat is awful for me to be in, which is every day right now in Tennessee. So I, again, just can't go outside, and that is usually my favorite place to be. When I do, I usually break out in hives within a few minutes and just become just fully beyond itching. That was a weird phrasing. Just extraordinarily itchy. Of course, I react to allergens indoors as well, so I can't really clean. Or when I do clean at my house, I used to wear a hazmat suit when I would clean. I can't find my hazmat suit right now. So maybe I'll clean and then I have to run and jump in the shower to rinse it off. And then of course that hurts to shower. And there's a whole process of that. So it's just kind of hard to do anything I would normally do. Yeah, and like, again, I don't leave my house. I don't hang out with people. I react to foods. Basically any food I eat, I have a reaction to, just because of the way your body processes things. Once it's focusing on processing the food, there's a way to explain it. Something about heat sending out, and so your skin reacts. Anyway, I get really itchy every time after I eat. Maybe not immediately, but a couple hours after, or an hour after, depends on what I'm eating. So I have to think about what I eat all of the time. Certain things are definitely more inflammatory. Obviously, I'm not drinking alcohol. I don't drink coffee. I don't have any added sugar, or processed food. But I still eat a lot. Like a lot more than I used to, because it's the way that I can find a distraction, especially at night. I'm eating at night when I should not be, like in the middle of the night. Because when you're so itchy, you just do anything to distract. Sorry, my eye is doing something weird right now. Wait, don't look at my hand. My room is messy right now. There's my bike. His name is Atticus, my bike. we're getting distracted because we don't sleep. I don't know what history to go over through like me trying to figure out what's going on with me. Did a lot of allergy testing. I did allergy shots. This was a little while back, and everything just kept getting worse. I kept getting more and more red and rashes and oozing and ripping, and the allergist eventually refused to give me any more shots because it was just so out of hand, which they should have refused because it was absolutely horrifying. I, of course, have done all of the blood work, all of it. It's probably why I fear needles now. I don't really fear them, I just really don't like them, just because I've had so much blood taken out of me, so many tests done. Nothing was really figured out other than I had, vitamin deficiencies here and there, and inflammatory levels, skyrocketed, because I have so much inflammation. Another random tidbit of this is that it makes me really shaky. I don't know what the mechanism is for that, why that happens. I'm not as shaky as I used to be, but I remember a while back it was just kind of all of the time I was shaking. And I would be trying to go to job interviews, or I would go. I remember a specific one, and I just absolutely couldn't get my hands to stop shaking. And of course, I'm also trying to cover up my red, rashy, ripped up hands. So I'm sure the person interviewing me thought I was on drugs. What do you look like when you're on meth? I don't know. Shaky and skin issues. I should know. I had clients who were on meth. Anyway, I'm kind of tired of talking about all this. I'm 33. This started when I was 27 and really got bad just before I turned 30. And it may be another year, 2 years, I'm not really sure, before this gets better, or significantly better. So that is the first half of my 30s that my entire life has been significantly impacted. It's affected my career entirely. I had to quit a job at the end of 2020, and I didn't work for 8 or 9 months. It was stupid that I was even trying to get jobs then. I felt so full of guilt and shame for not working at that time, and I would go to interviews and I get really angry about this sometimes. I get really angry that the doctors didn't know or didn't warn me. I get angry that they didn't believe me, and that what I was like, they just kept giving me the exact thing that was hurting me, and that just kept prolonging this. And no one has really believed me until recently that this is what it is. People believed something was wrong, but they didn't know what it was. It's just affected everything. It's affected my friendships. I feel like I've lost friends, or at least have lost the depth of the friendships, I guess. 'Cause I'm not able to do much of anything, especially right now. But even over multiple years, it's just I've always been limited. And so people stop inviting you, and that's okay. Like, I get it. It affects your relationship with your significant other. This really all got bad pretty quickly after I was married. I mean, I'm still married, but after I got married. And so I've always been the sick one now. I don't like being that family member or that spouse. I guess I just feel like I've fallen behind and I'm not sure how to catch back up, and I don't know when this will fully end, so I don't know when I get to catch back up. And I don't know what kind of job to take, and it's hard to take a job when you don't sleep at all at night. Like, literally not sleep at all. Anyway, it's just kind of rough. I guess that's all I have to say, but I feel like I said a whole bunch, but also didn't actually say anything. If you know anyone that's using a bunch of steroids, I guess warn them or tell them to watch out. If you have any major skin issues that you used to never have and you've used steroids, I would maybe look into it. I have been calling dermatologists that I saw over the years that I was trying to figure out what was going on with my body. And I would tell them I did not want to do topical steroids, but that kept being what they wanted to give me. And sometimes I would just cave in and be like, all right, sure, send in the script, and I'm just going to go. Of course, I was nice about it because that's just what I do, but I don't want to do that anymore. But I called recently to ask what they prescribed me, because some of it I couldn't remember, and then also how they prescribed it to me, like how much they told me to use it, for how long. One of them said apply twice daily as needed. That's not very clear or descriptive of how long you're going to be using that. And I asked if there was any sort of timeline for those, and the nurse recently just said, well, just until it goes away. But what if it never goes away? But also I wanted to know one place that I called. So this is the one that I think it said apply twice daily as needed, and you're only supposed to use steroids for 2 weeks. And steroids, the little goes a long way, but this is what they gave me. So I'm only supposed to use this 2 weeks, and very rarely throughout the year. But it is like, this is huge. I didn't use it, so there's a whole bunch in there, but I'm keeping it to show. It also, like, it doesn't call it a steroid cream. It's triamcinolone acetonide ointment. There have been some things I've been prescribed that I had no idea had steroids in them. There was a spray I was spraying all over my body in 2019, and I think that's what may have really done this to me. Because I had no idea it was a steroid. that dermatologist, I told her I did not want to be on steroids, so I thought what she prescribed to me wasn't a steroid. I should have researched more, and I learned after a few months of using it, that it was a steroid. People with topical steroid withdrawal tend to have very high levels of depression and anxiety, which is understandable as, one, you're not sleeping, two, you're isolated. Your entire life is affected by this. Oh my gosh, I keep losing my train of thought. Wow. I looked at one statistic, and it says about 16% experience suicidal ideation. That statistic is from a few years ago. It could be different. Again, very understandable, because you don't really know when this is going to end. Depends on how long you use steroids, how healthy your body is in general. It depends on a whole lot of things, and it's just not really known how long it will take. It just, so many factors. So this video has gone on for way too long, but I could tell so much more about it all, but I won't. Eventually I might tell more about the treatment I was on, which was Dupixent, which did not go well. And just wanted to note that one reason why this has gone on for so long, this topical steroid withdrawal, is I have done oral steroids and injected steroids probably every 6 months or every 9 months, here and there throughout the past couple of years, just to make it through, to be able to go on some trips, to be able to work. And I'm at a point where I'm just not going to do that anymore. I can't do it anymore, and I need this to end. Anyway, thank you for watching this really long video, if you did. Or if you're seeing this, then you may, I don't know. Okay. I need to go to bed. Yeah, you see that? You see all these wrinkles? Goodbye.